Over 5,000 lives are lost yearly, all in the cold hands of peptic ulcer. The World Health Organization released a report in 2018 stating that 100,000 cases of peptic ulcer is being recorded yearly. That's alarming. The higher category of this report states that students or student community have a higher level of prevalence of peptic ulcer. We are currently visiting universities to ascertain the prevalence level of peptic ulcer among students. This is InfoscopeMediaTV and I am Mezie Africa. Join me on this journey.
The first symptom I had was severe stomach pain, especially at night, then severe chest pain, then I went to the hospital, then I was diagnosed.
So what was the cause for you?
Well, I think, I was told that it was as a result of abuse of NSAID drugs, which is non-steroidal anti-inflammatory drugs.
Okay. Told by who?
The doctor.
Okay, all right.
So the drug was actually prescribed for my menstrual pain. So I was actually supposed to be taking one a day, okay. But because I wanted it to be faster, I started taking two.
Most of the time, people don't really know these symptoms. But then, when you experience some sort of burning sensation, bloating, vomiting, even stool with blood and all those things, these are likely signs of ulcer. And then I will advise a person should go for tests. That's very important because you can't just start self-medicating when you don't know what the cause is. So maybe first thing first, go for tests, and then when you confirm that it's ulcer, you now start taking the necessary precautions, reduce or don't even avoid NSAIDs. Okay. Things like painkillers, ibuprofens, all those things. You shouldn't even need them. You don't need them, so you should avoid them. And then secondly, maintain good hygiene. I always tell people because this infection, the Helicobacter, the H. pylori is just by it's a bacteria, and you contact it by when you have a compromised or let's say a reduced hygiene routine. Okay. So good hygiene is very important. Then reduce the air or intake of any NSAIDs, and then manage stress, avoid alcohol, all those things.
As far back as 2018, the World Health Organization released a report stating that 100,000 cases of peptic ulcer is reported yearly. This is 2021. Do you feel that there is an increase on that report?
Of course. When you, like, I've seen the situation by even my mom going to the chemist to get drugs for pain. See that the chemist will actually prescribe maybe a combination of drugs that are still NSAIDs for just a particular pain. I kind of wonder if we are still living in this age and people are still ignorant of the correlation between non-steroidal drugs and ulcer. Sorry.
Okay. So at what point would you say that peptic ulcer can lead to death?
Well, in severe, maybe I don't know the stage because I'm not actually a medical practitioner, but I know that peptic ulcer can actually kill. Okay. Yes, I know that.
Can there be an absolute cure for peptic ulcer?
Not really, it's just the management. Yes, because ulcer is just like an internal wound. Okay. So just like when you have a wound, you have to manage the wound. Okay. So that's why ulcer is. That's why they take drugs like omeprazole or cimetidine, which are either proton pump inhibitors or H2 receptors antagonists.
Okay, according to the doctor, it was caused as a result of starvation and amongst other things. Okay. Like that is the major one I can remember.
So you starve yourself intentionally or?
No, not intentionally.
So currently you have ulcer. Let's put it that way, right?
Yes.
How are you being able to manage it?
I've been able to manage it by feeding in time. I don't wait until I'm very hungry before I eat, and I always have anything milky around me. Okay. When I have the feelings, heartburn, my stomach growling, I could just go with anything milk and it will calm me down.
Okay, I've known about it for a long time though, but I found that I also have it this year, around that March, April, complaining about headaches, severe headache. I was busy treating malaria and typhoid, but it was too much. I had to go to test at Obinze, and doctor was like, I have ulcer. Like, from where to I used to eat, but I told me that ulcer is not only for those that don't eat. Sometimes you might have ulcer like that, but what I was told.
So what did they tell you is the cause of your own ulcer?
He only tell me like if I have heartburn, most time I do have heartburn, chest pain, migraine. Said most time those causes ulcer. Okay. And she prescribed drugs for me. That's all.
Have you been taking your drugs?
Yes, I'm taking it.
What's the progress now?
Okay. Well, now the migraine is not as severe as before.
Okay.
At first when I started taking the drug, I do have effects like chest pain, seriously cold, and maybe the drug was too much for me. But at a point, then stopped.
I was feeling pains, my upper abdomen most times at night. So of course I went to the hospital, and then the doctor told me I had ulcer, and it was peptic ulcer. And he told me that what caused mine was I was taking pain relievers frequently. Then, not starving or whatever. I was taking pain relievers, so that was what caused mine.
So you take a lot of it?
Then yes, a lot of it.
So did he mention any word like abuse of the drugs, right?
Of the pain relievers, yes.
Okay, so hearing the ordeal and the tales from the respondents and my correspondents on today's edition of this show makes me want to cry. But tears and cries won't solve the problem. Effective health promotion and education strategy will solve the problem. It is a tough time hearing the stories from these people concerning the prevalence of peptic ulcer in student community. This is InfoscopeMediaTV, and I am Mezie Africa. Thank you for hanging on.